The telltale signs of the overindulgence were all too clear on the weekend, with numerous viral videos highlighting the aftermath of binge drinking just days after the weeks-long ban on intoxicating liquor was lifted. The prohibition on the sale of booze was all in a bid to limit social gatherings. The popping sound of uncorked bottles and the snapping of beer cans and twisted bottle caps opened the floodgates as alcohol consumers emerged from hibernation in droves to quench their thirst. Drivers whose judgment appeared impaired were caught on camera wreaking havoc on the nation's roadways, putting both themselves and others in harm's way.
This is not new. We have had numerous people losing their lives as a result of drunken drivers hitting them and as a result of drunken drivers having motor vehicle accidents. And I find in St. Lucia we do not take that seriously enough. The penalties are not high enough, and we really have to look at doing something about that.
Minister for Health Mary Isaac has scolded heavy imbibers whose apparent lack of control on the weekend could lead officials to reconsider the prohibition on alcohol.
People are behaving as though alcohol is a priority. Alcohol is something they cannot do without. But alcohol has been very destructive to families and to lives as well. So maybe if our citizens cannot understand that they need to be responsible when they consume alcohol, we may well have to maybe ban alcohol altogether.
While some credit social media for magnifying the problem, others view some of the videos as a glorification of risky behavior. The use of social media to spotlight the apparent inebriation of a few citizens has been heavily criticized by Isaac.
It is really portraying us as a country of drunken alcoholics, and that is not very good. We need to stop that. That is not what social media is intended for. And we ought to stop using social media to destroy people, to destroy ourselves, to destroy our economy, and to destroy each other.
But what of the systems to help people suffering with addictions and the disease of alcoholism? Turning Point at the wellness facility remains a voluntary admission center, and Isaac points to the difficulties that many have in identifying those in need of help.
There's also a stigma attached to Turning Point, and a lot of people, even if they were to agree to get help, they may not necessarily want to be seen to be coming to Turning Point. So that is another problem.
And while the island grapples with a once-in-a-century pandemic, Isaac urges persons to be more mindful of their overall health and well-being. She notes places an undue burden on an already beleaguered healthcare system. Solange Alfred, HTS News Force.